So today we're going to be covering plantar fasciitis. A lot of people tend to suffer from this type of pathology. It's kind of that pain in the foot, but we're going to really go over what it is, how to diagnose it, what are the issues associated with it, and we'll even give you a simple case of what someone may present with. So here's an example of a typical presentation someone may have. So here we have a 38-year-old female who complains of frequent sharp and burning pain in the bottom of both feet. Pain is usually, it started around 6 to 7 months ago. VAS stands for Visual Analog Scale. So 10 being the worst pain you've ever had, 1 nothing at all. She's got about an 8 out of 10, so it's pretty flared up. She began an intense training program 5 days a week, 7 months ago. So she's trying to get into whatever sport she's doing, whatever fitness it is, depending on what it is, or just a typical. She began an intense training program, usually around 5 days per week, which began around 7 months ago. So whether it's for some sport that she's doing, whether she wants to get fit, weight, or whatever it is that she needs to do, but now she has these issues. So the patient is on her feet most of the day, and the pain is usually worse at night. So one of the most common causes of heel pain is plantar fasciitis, usually caused by inflammation to the plantar fascia. So here's some kind of interesting statistics for you. So approximately 1% of the US adults reported a diagnosis of plantar fasciitis in the last year. Females were 2.5 times more likely to have plantar fasciitis than males. Body mass index was strongly associated with plantar fasciitis. So those with a body mass index of 30 or more were around 5 times more likely to have plantar fasciitis. Another statistic is that more than 61% reported having pain every day. So more than 61% reported having pain every day, and almost 54% reported that their pain interfered with normal work activities, at least moderately. So it's not only at work that this can be an issue. This can be going home, this could be doing your gardening, this could be walking around, just even going to the gym, or even getting in and out of your car at the beginning of your day. This is one of those issues that can cause a debilitating injury or can affect your day-to-day in a negative way. So here's kind of a diagram showing the connective tissue. So the plantar fascia is a connective tissue or aponeurosis. It supports the arch of the bottom. This supports the bottom arch of the foot or the plantar side. It runs from the calcaneal tuberosity, kind of this issue right here, as you can see. So the plantar fascia is a connective tissue aponeurosis. It tends to run from the bottom of the foot or the plantar side. It runs from the calcaneal tuberosity. So here's the calcaneus, here's the actual tuberosity. Tuberosity just means that point of bone that sticks out and is attachment site for the connective tissue in this area. And it runs from the calcaneal tuberosity to the heads of all the metatarsal bones. It's a long, pretty thick band, and it does support the bottom arch of the foot pretty well. So when this flares up, that's why people tend to have pain all along this area here. A little side note is that research indicates that the plantar fascia is not actually fascia, rather it's an aponeurosis. So kind of going over what that means is that fascia is that fibrous tissue that envelops muscles, organs, or binds muscles together in other tissues, and aponeurosis can act as a fascia. So this is kind of that idea, all squares are rectangles, but not all rectangles are squares. So here we kind of got a diagram with the anatomy kind of dissected away. So the aponeurosis is a white flattened or ribbon-like tendon expansion serving mainly to connect a muscle with the parts that it moves. The plantar fascia is made up of predominantly longitudinally oriented collagen fibers. There are 3 distinct structures or components: the medial component, then we have the central component, and then we have the lateral component. So you can kind of see we have the medial component here, central component here, and then we have the lateral component here. The central component is the largest and most prominent. So you can kind of see it coming here as it comes from the whole part of the foot, as we said, from the calcaneal tuberosity to the base of the metatarsal bones. So as we can see that the origin of the plantar fascia is at the medial process of the calcaneal tuberosity. You can kind of see it here. So there's kind of the lateral view. You can kind of see the anterior talar articular surface, and then here's the other side of it here. So we won't go too much into it there. The plantar fascia inserts towards the front of the foot, dividing at the mid-metatarsals into 5 sections, each extending into the toe, straddling the flexor tendons. During walking, the plantar aponeurosis functions mainly during heel rise or toe off. So kind of as you kind of lift up and kind of walk forward, lift up and walk forward. So as you kind of go here, here. This allows it to stabilize the arch of the foot and allows flexion of the first metatarsal, which is kind of the first bone there, enabling the first metatarsal to carry the majority of the body weight. As you kind of come here, there you go. You kind of come here, there you go. It also provides shock absorption when the foot hits the ground. So you can kind of see that it's a very dynamic aponeurosis or connective tissue area that allows for all the dynamic movement, stability, flexibility, and mobility of your foot. So we are animals that kind of walk every day and kind of get moving all the time. So this is really one of those things that if it is bothering bothering you, it's gonna be a problem in your day-to-day. So let's go over kind of the typical presentation of plantar fasciitis. So the history has usually some sort of intense, sharp heel pain with the first couple of steps in the morning or after long periods without bearing weight. So, you know, sitting down for a long time, driving for a while, if you gotta commute to work. So for those first couple steps, it's gonna be an issue until you actually get that plantar fascia moving. Often the pain will decrease significantly. Often the pain will decrease significantly with ambulation or athletic warm-up, but tends to increase throughout the day as activity increases. So as you begin to move it, it kind of gets unstuck, gets moving, but then as you move it a lot more throughout the day or through your walking, or if you're moving a lot on your feet, then it tends to get a lot worse in the evening. And in some severe cases, patients can complain of heel pain after long periods of prolonged sitting. So as we said before, so kind of a typical presentation is that it'll tend to bother individuals so much that they will stop doing what bothers them, you know. So if that's walking, in this case it was someone who's working out, starting an intense regimen for exercise, whether it's weight loss or for some sort of competition or sports training event or some sort of marathon. Now they have to stop doing what they enjoy doing, when that's kind of where the issue begins.